Hey, so welcome to our group presentation on CAUTI prevention. We'll be covering the following topics today: quality safety measures, the individual indicator, finding out what causes CAUTIs and how to prevent them, the role of informatics in CAUTI prevention, the role of the nurse, and finally, the role of informatics in nursing. This presentation is brought to you by Cody, Lexi, myself, Gabriel, Samantha, Macy, Tristan, Willow, and Catalina. We'll also be introducing ourselves again when the slides start because we are required to do so. So sorry if we repeat ourselves there, but enjoy the presentation.
Our group is going to talk about CAUTI prevention and how it applies within the dashboard in informatics of nursing. Hello, this is Samantha, and I'll be giving a brief overview of the quality of safety measures in organizations. A quality dashboard is a collaborative resource for interprofessional healthcare teams that displays areas of improvement for administration management of an organization or unit. These dashboards are composed of quality indicators. Quality indicators are evidence-based tools that display patient risk information. This information can be used to potentially identify risks for the patient and improve overall quality of patient care. Unit-specific dashboards provide indicators that are aligned with the unit's practice guidelines and serve as sustainability strategy for continued implementation. Organizational level use of the dashboard is to manage a variety of operational, clinical, and professional practice activities. The data used within a dashboard is based on performance data for the specific unit or organization the dashboard is being used for. This helps them identify quality care improvements for their unit or organization.
Hey, my name is Catalina Adams, and I'm going to be talking about individual indicators for catheter-acquired urinary tract infections. For each quarter, the target for CAUTIs was 0, but in quarter 1, there were actually 2. In the second quarter, there were 3. In the third, there were 3. And in the fourth, there were 4. There are many reasons we measure CAUTIs. Some of the reasons I found were it is the most common healthcare-associated infection. Patients have longer stays, causing their healthcare process to increase. Patients suffer from the consequences such as death, increased medical bills, and blood infections. And then nurses are not properly educated on prevention strategies. The CDC said an estimated 17 to 69% of CAUTIs may be preventable with infection control. And then the Agency for Healthcare Research and Quality reported an estimated U.S. cost per year for CAUTIs was $340 to $450 million. Also, the CMS denies reimbursements for CAUTIs because they can be prevented, and they feel it's the hospital and patient's responsibility.
Hello, this is Tristan, and I'll be discussing possible deficits that can lead to an increase in the occurrence of CAUTIs. One major problem is the lack of education of healthcare workers and how to properly insert and care for indwelling urinary catheters. In one multi-phase education program, the rate of CAUTI episodes decreased from 14.9 to 1.1 per 1,000 catheter days by the time the program had been completed. Another cause for CAUTI presence is leaving a catheter in for too long or placing one when it is not necessarily needed. In the previously mentioned study, after the education phases, catheter placement went from a baseline of 74.6% to 44.2%. When there are less catheters placed unnecessarily, then CAUTIs cannot occur, and when they are removed as soon as possible, the chances also decreased, as every day one is left in place, the risk for development increases by 3 to 7%. Improper hand hygiene and incorrect use of aseptic insertion technique can also increase the chance for developing a CAUTI, as not performing these correctly can introduce bacteria to the area from the very beginning. Additionally, the material of the catheter used can increase the risk for infection. CDC guidelines recommend silicone as the best material for use to reduce the risk of incrustation in the catheter, and there are now developments being made in antimicrobial impregnated silicone to use to help prevent the development of catheters, or to help prevent the development of bacteria biofilms in the catheters. Furthermore, improper maintenance and care of previously placed catheters can increase the chance of infection. Catheters should be regularly checked and assessed to look for signs of possible infection and to ensure that they are still properly placed, not obstructed, and whether they can be removed yet or not. All of these are possible causes for increased rates of CAUTIs, which lead to decreased quality of patient care as they now have another complication to deal with and more money and time from the healthcare facility to compensate for this.
Hi, I'm Macy Brown, and I will be addressing the deficit seen in healthcare to improve performance of preventing CAUTIs. Thoroughly assessing the need for a catheter is very important and should be considered a last resort to other treatments. Proper placement is also a deficit seen, and the nurse should always be very precise in placement of catheters to avoid adverse effects. Using aseptic technique along with hand hygiene is extremely important to reduce the instance of cross-contamination and chance for infection of the catheter side. Maintenance of the catheter post-placement will drastically reduce the instance of CAUTIs because changes can be routinely documented and treated before things get worse. Nurses should always remember that catheters should be removed as soon as possible to once again reduce the chance of infection and irritation. Awareness of these deficits and precautions can greatly reduce the instance of CAUTIs in the healthcare setting. It is shown that when all members of the nursing team are aware and remain vigilant with routine maintenance of these precautions, the incidence of CAUTIs can go down almost 40%.
This is Willow Barb, and I'll be going over the application of monitoring quality indicators. So the EHR can be used to improve documentation, and proper documentation can reduce the rates of CAUTI. For context, it was found that up to 50% of catheterizations lacked proper documentation as to why the catheter was initiated. Unnecessary catheterizations and prolonged duration can increase the risk of CAUTI, and technology in the EHR can help predict this. Reminders and alerts embedded in the EHR can prompt providers to document why a catheter is being initiated or why it can be continued. A clinical decision support system can be used to remind providers that a catheter is still in use and give reasons as to why it should be discontinued if there's no reason to continue it.
Doing so will help remind and refresh one another on ways to have successful quality and care while performing the procedure. The nurse will know these interventions are making an impact by seeing the UTIs and morbidity numbers decrease. If these numbers keep rising, then the nurse will need to reevaluate and find out where he or she is messing up at that is causing the high infection rates. Documentation of information such as a care plan for patients are very important. A nurse will also want to make sure the documentation tells when and why the catheter was given.
Hello, this is Cody Allen, and I'll be discussing the correlation of informatics and CAUTIs. The role of informatics in this scenario of CAUTI prevention is to implement data tracking for how and when the catheter was inserted and cared for. Informatics can be used as an effective resource for healthcare providers to help keep track of actions that can lead to infections. Using informatics to specify the infections in hospitals, such as a CAUTI, will dramatically lower the rates of those infections. Also, data mining is important in the prevention of CAUTIs as it allows healthcare workers to explore other data entries. This also lets them compare and contrast to see the reasoning behind specific CAUTIs. For the scenario given, there were at least 2 CAUTIs per quarter. The teaching of informatics and prevention of CAUTIs will hopefully reduce those numbers within the units. This teaching can be done by showing the data retrieved from the data mining and how to properly use the EHR systems to include data that is important to the prevention of CAUTIs.
Alrighty, this is Gabe, and I'm going to be summarizing what the presentation has covered. So, performance measures allow healthcare workers to measure the efficacy of each intervention. This means that when an intervention is put into place, the effectiveness of that intervention can be measured, and based off that data, changes can be made to boost the performance. In this case, CAUTI prevention. You know where to make those changes based off performance deficit, which is where the data shows that a specific intervention is not working or aiding in the reduction of CAUTIs. It is important to follow the best practices because a recent study showed that CAUTIs could be reduced by up to 54% by following the best practices. Furthermore, preventing CAUTIs is cost effective. By investing in CAUTI prevention programs, a 120-bed nursing home could save net up to $34,000 yearly, and other healthcare facilities have an 85% chance of creating a cost-effective CAUTI prevention program. Therefore, performance measures help determine the best practices for CAUTI prevention, which in turn reduces the incidence rate of CAUTIs, thus reducing the costs. This has been our presentation on CAUTI prevention, and here are all of our sources. All right, now let's hope this recorded.